Hi, I'm David. I'm a pharmacist, and I'd like to talk to you about vaccinating different communities. So let's talk about immunocompromised patients. Now, this is a population that is very near and dear to my heart because they obviously are at very high risk of infection and also at high risk of more severe forms of infection, but we don't talk about them as much as other patients in other groups, like patients with diabetes or other types of chronic conditions. But vaccination of this population is incredibly important, and it's our duty really to seek these folks out. So some suggestions on how to find immunocompromised patients and have conversations with them about immunizations. First off, probably one of the most common reasons for immunocompromise is cancer patients receiving chemotherapy, or also certain cancer patients who have liquid tumors like lymphoma or leukemia, which in and of themselves are immunocompromising. There are other groups of patients like those with chronic renal failure, those with HIV, and those with functional or anatomic asplenia, like those with sickle cell disease, or say folks who had experienced some sort of trauma and needed to get their spleen removed. There are other means of identifying these patients based on review of medications. So patients receiving chronic corticosteroids, systemic corticosteroids for greater than 2 weeks at a dose of 20 milligrams of prednisone equivalent or more are considered immunocompromised. You may be able to find your transplant patients as well, those receiving medications like tacrolimus, cyclosporin, or mycophenolate. And then there are also other patients who have rheumatologic conditions that are on immunosuppressive meds like methotrexate, azathioprine, or receiving biologic agents like rituximab. Now, another very important consideration regarding immunocompromised status is that self-report of this status is sufficient for vaccine eligibility. You don't need oodles and oodles of documentation from their physician or from their hospital to document that they're immunocompromised. If you have a list of these immunocompromising conditions and medications and they attest to an immunocompromised status, that is sufficient for vaccine eligibility. All right, so let's talk about certain vaccine considerations for this group. The important thing to remember is that the typical age cutoffs that we think about for many of these vaccines frequently don't apply for immunocompromised patients because of their immunocompromised status, they are de facto at higher risk for infection. So the big vaccines that I think about are pneumococcal and shingles vaccine. Normally we think about giving these vaccines at age 50 or greater. However, for immunocompromised patients, they can receive these vaccines even down to 18 years or older. Additionally, RSV vaccine, which we generally recommend for 75 years and older, immunocompromised patients can receive this down to age 60. COVID vaccine also has some considerations for immunocompromised status, and that is that immunocompromised patients may benefit from multiple doses, so 2 or more doses of COVID vaccine through shared clinical decision making. And finally, transplant patients specifically may benefit from high-dose or adjuvanted flu vaccine instead of the standard dose vaccine. Now, there are a couple of safety considerations to think about for immunocompromised patients. The big one is to avoid live vaccines. So examples of this would include flu mist or MMR, which should be avoided in this population. So those are just some major considerations about vaccinating immunocompromised patients.